1 in 3 people with epilepsy will continue to have seizures despite the best medications we as doctors can offer. We call this form of epilepsy drug-resistant epilepsy, and this occurs after someone fails to respond to 2 anti-seizure drugs. The chance of someone responding to a 3rd, 4th, or 5th medication is extremely small. So at this point, we begin looking for other treatments that could potentially cure the patient's seizures. The most effective way we can do that is with epilepsy surgery. The most powerful surgery to treat epilepsy is to find the seizure focus, the malfunctioning part of the brain where the seizures come from, and surgically remove it. This can be done with standard microsurgical techniques or with newer tools, like minimally invasive lasers. Patients have about a 2 in 3 chance of being free of seizures after this kind of surgery. But before we remove the part of the brain causing seizures, we have to find the part of the brain causing seizures. Finding the source of a patient's epilepsy can require several types of tests, like EEGs, MRIs, and nuclear medicine scans. In some cases, we still can't find the source of the seizures after doing these tests. At that point, we typically need a surgery to help us pinpoint the seizure focus. This is called intracranial monitoring, where electrodes are placed inside the skull to precisely map out someone's seizures. When we have that information, we can then move on to do a more targeted surgery. In many cases, we will find that seizures are coming from a single spot in the brain and one that can be safely removed. But sometimes the seizures come from a spot that's too critical to remove, like a language area or one that controls movement. Or sometimes there are too many spots to remove. In these cases, we have a variety of neuromodulatory therapies like responsive neurostimulation, vagus nerve stimulation, and deep brain stimulation, all of which can significantly reduce the frequency of seizures without any damage to the brain. The most important message is that epilepsy can be treated. Even if it doesn't respond to medication, there are many other therapies we can try, more now than ever before.